very small region. It is not in a major region. It is a very small region, but functionally is very important. So that is why it will be said. So ಮೂರ್ತಿ ಚಿಕ್ಕದಾದರೂ ಕೀರ್ತಿ ದೊಡ್ಡದು. That means it is a very small area, but its controlling functional system is very important and very identical related. So where this hypothalamus is located? Just below the thalamus on the medial side. It forms the wall of the third ventricle. So lies below the thalamus on the medial side, and it forms the wall of the third ventricle. So the hypothalamus is related to the structures, that is mainly in the floor of the third ventricle. The hypothalamus is related to the structures that is in the floor of the third ventricle. It is involved in regulation of internal milia of the body, or said another way, for homeostatic control. Its neuroendocrine role in conjunction with the pituitary gland. So that means it is related with the pituitary gland, that is endocrine related. Its influence on the autonomic nervous system. So it also very important controlling center in related to the autonomic nervous system. So neuroendocrine role in conjunction with the pituitary gland and influences in the autonomic nervous system, which helps the regulator regulate the body temperature, and also it helps to the regulation of body temperature. The cardiovascular system and food and water intake. So it also associated with the regulation of the body temperature, and it controls the cardiovascular system and as well as food and water intake related. So there are the nuclei in the hypothalamus. So mainly supraoptic and suprachiasmatic nucleus, paraventricular nucleus, preoptic nucleus, anterior nucleus, ventromedial nucleus, dorsomedial nucleus, arcuate nucleus, lateral tuberal nucleus, premammillary nucleus, and posterior nucleus. So these are the nucleuses present in the hypothalamus. So usually it is a complex neuroglandular mechanism concerned with the regulation of visceral and vasomotor activities of the body. So in functional related, it is a complex neuroglandular mechanism concerned with the regulation of visceral and vasomotor activities of the body. So the hypothalamus has regulatory influences on autonomic system. Mainly it will be influences on the autonomic system, that is parasympathetic and sympathetic. So the parasympathetic center lies in the anterior part of the hypothalamus, then sympathetic center lies in the posterior part of the hypothalamus. The effects upon overlap, thus the considerable effect on cardiovascular, respiratory and alimentary function. Then again, with the regulation of the body temperature, that is the preoptic nucleus acts as a thermostat to control the body temperature. Then the regulation of eating and drinking behaviors, that is feelings of hunger and satiety. So the lateral zone stimulates the hunger, thirst and drinking. So the medial zone stimulates satiety, that is satiety means the satisfaction. So the stimulation of the feeding center or damage of the satiety center cause the hyperphagia, that is overeating, leading to the obesity. That is one of the clinical points, that is that the stimulation of the feeding center or damage of the satiety center that cause the hyperphagia, that is overeating, so that leading to the obesity. Then stimulation of the satiety center or damage of the feeding center cause hypophagia, death or even aphasia, that is, and death from starvation. Both aspects that will be the complications. So stimulation of third center causes copious drinking and overhydration. So then plays a complex role in the way a person responds to stress is also one of the important points. Then nervous connection with the posterior lobe, vascular connection with the anterior lobe of hypophysia, that is pituitary gland, indirectly influences the thyroid gland, adrenal cortex, and the gonads. That means there is a nervous connection with the posterior lobe, vascular connection with the anterior lobe of hypophysis, that is pituitary gland, and indirectly influences on the thyroid, adrenal, and gonads of the gland. Then it has the neurosecretion. The neurosecretions, that is neurohormones, one is oxytocin and another one is vasopressin. So the vasopressin is antidiuretic hormone, that is ADH, antidiuretic hormone. So these are secreted by the hypothalamus and transported to the infundibulum to the posterior lobe of the hypophysis cerebri. So these two hormones are secreted by the hypothalamus, but they transmit to the pituitary, then it will be act on that particular function. This is very important, you have to be remembered. Then emotional behavior. The emotions like fear, anger, pleasure, and reward. So these faculties are controlled by the hypothalamus, the limbic system, and the prefrontal cortexes are involved with this of the functions. Be remembered, emotional behavior, whatever it may be a fear or a anger or a pleasure and a reward. That is one of the important emotional behavior points. Then the regulation of the sexual activity and reproduction. So it will be both in male and female. It will be exerts an effect on gametogenesis, on ovarian and uterine cycles, on the development of the secondary sexual characters that influencing the secretion of gonadotropic hormone by the hypophysis cerebri. That means it is indirectly involved, influences. It will be sexual activity related, like formations of the gametogenesis. The formation of the gametogenesis means in ovarian, that is ovum, and in the male, that is sperm. So, and also related to the uterine cycles and on the development of secondary sexual characteristic features, all that will be related to the hypothalamus. Then again, it controls the fat and carbohydrate metabolism. So it also controls the fat and carbohydrate metabolism. Then also it will be controls the biological clock. The biological clock means like normal sleeping hours, wakefulness hours, control of cyclic activities, the normal whatever the biological clock, so that will be also controlled by the hypothalamus. Lesions of the anterior hypothalamus seriously disturb and rhythm of sleep and wakefulness. So these are the things you have to be remembered. And simple hypothalamic disorder, that is diabetes insipidus, obesity, disturbances of sleep, somnolence, that is sleepiness and persistent sleep, loss of temperature control, sexual disturbances, that is either precocity or impotence. Then disorders of the fat and carbohydrate metabolism, there may be hyperglycemia and glycosuria, acute ulcerations in the upper part of the gastrointestinal tract, and diencephalic autonomic epilepsy. This is also characterized by flushing, sweating, salivation, lacrimation, tachycardia, retardation of respiratory rate, and unconsciousness, etc. So these are the points in related to the hypothalamic disorders. So be remembered, Among all that part of the diencephalon, the hypothalamus is very important. It controls the most of the activities of the human body. So that is the higher portion that controls the most of the activities of the hypothalamus.